Welcome everybody. It is 1 o'clock on the dot here on the East Coast, so I just wanted to go ahead and kick things off. My name is Lisa. I'm the broker manager here with Crowe and Associates. On with me today, I have Gary and Chris, and they are with Medicare Express. That is a appointment generating system for leads. I'm going to go ahead and pass it over to them, let them get all their information out. If you do have any questions, please go ahead, type them into the chat. As everybody has been auto muted, you won't have the opportunity to chime in, but you can certainly type in questions. So with that, we're going to go ahead and pass it over to you, Gary. You're going to go ahead and I'm just going to mute my mic because you don't have any slides, right?
No, perfect.
Okay,
Thank you very much. And again, thank you, Lisa and Crowe and Associates, for allowing us to talk to some of your downline agents today. We're really looking forward to it. And thanks to the agents as well as taking some time out of your busy day. My name is Gary Gore. I'm the Vice President of Sales here at Medicare Express. And prior to joining Medicare Express, I've been in the Medicare business for over 20 years, but prior to joining Medicare Express, I was working for another large FMO. And from an FMO's perspective, one of the important factors that FMOs have to or should provide is some sort of, lead opportunities to their downlines. And so back in 2020 and even worse in 2021, the FMO that I worked for was heavily involved in direct mail purchasing, and that was kind of our lead gen for our downlines. And what we noticed is a significant drop off in returns, and so we started interviewing lead gen companies literally in January of 2023 to get ready, for the next AEP. And we were mainly interviewing a lot of Facebook lead gen companies because that's kind of where a lot of the business was going, from direct mail to Facebook. And what we found was a lot of similarities. Nobody really stood out. People would develop a marketing program, put it on some sort of a YouTube or Facebook type situation, and they would generate leads. And one of my good friends in the business, his company offers Facebook leads for like $1,000 for 50 leads, right, per month. And if any of you out there have bought leads, whether direct mail or Facebook, you know how time consuming it is to go through those 50 names. Hopefully you get 20 people that you actually speak to, and then hopefully you're able to book 10 meetings, and hopefully 5 show up, and you make a little bit of money. And what do? You start that madness over again the next month. Well, when I met Doug and Rob, the co-founders of Medicare Express, immediately we knew that we met somebody that had a completely different program than what anybody else was offering out there. What we do here at Medicare Express is we take all that back-end, time-consuming, frustrating work away from you and actually do that for you. We generate leads through various different marketing campaigns, social media, native media, and we have our own owned and operated sites that calls come into as well. And through that mixture, we generate leads. And what we do with that lead, it comes into our department, whether it's a direct consumer initiated lead, or if it's something that's somebody filled out online. We wait the appropriate 48 hours before we call them back, because they give us permission to call them back. And then we go through what I call our secret sauce. We go through not one, but 2 different qualifying departments. The first department is kind of like, we call it the intent team, right? They go through a series of questions, making sure that the person that they're talking to is a good candidate for a Medicare meeting. And there's a litany of questions that they go through, but just to give you an idea, we verify. First of all, we voice record the whole conversation, and we voice record a scope for you. So we capture a scope. We tell you what carrier they're on. We verify Medicare and Medicaid to the best of our ability. What I mean by best of our ability is we do not have access to Marks or any of the other verification systems that you or your uplines may have to verify Medicare's Part A and B. So we have to ask second and third level questions like, Mr. Consumer, do you have Medicare A and B? Yes. You know the red, white, and blue card? Yes. Do you know where the red, white, and blue card is? Yes. And similar questions to Medicaid. And then the other thing that the final thing that we do is we gather all the information that consumer is the questions that they have, whether it be I'm looking for a food card or a better dental plan, or I'm aging in, or I'm moving, whatever the case may be. We put all that information into a portal, which Chris will demo for you here in a few minutes. All that information is dumped in the portal, and then based on the availability that you give us from your end, we actually book the meeting right into your calendar. We link calendars with your calendar. We cannot see who you're with, where and where you're at, because it's a blacked out area in your calendar, but we see the open areas in your calendar. And if we're able to get the consumer to agree to a time where you have an opening, we book that meeting right into your calendar. Just to give you an idea, when we get these leads that come in, out of every 100 leads that come in, we disqualify about 92 of them. So you are getting a qualified, high intent Medicare beneficiary to talk to. And so this program is great for all levels of agents. If you're brand new out there on the phone, or if you're just in the business 2 or 3 years, or even if you're a veteran, this program can work for you. For the brand new agent, well, actually, let me take a step back. There's 3 things really that determine volume from an agent's perspective. One is, how many agents do we have currently competing in that same market with you? That's a factor. The other factor is, how's our marketing doing in your neck of the woods, your county, your state, right? And as you all know, marketing is like a roller coaster. Some weeks and months it's great, and then others it's not. So, and then the third and final thing that determines a volume for us is how much time do you as an agent give us to book meetings in your calendar? Okay, and so obviously the more time you give us, the more opportunities and the more time slots you have to get meetings booked into your calendar. So for that brand new agent, you don't have any community-based relationships yet. You don't have you don't have a book to get referrals yet. So you're probably out there buying leads or looking for somebody to talk to. And so you probably want to give me 40, 50 hours a week in your calendar. That second, third, fourth year veteran that has 200 or 300, 400 people in their book now, that starting to get a few referrals from your book, starting to develop some relationships in the community and senior centers of influence, you may give me 30, 35 hours a week. And then that seasoned agent that really doesn't buy a lot of leads because they get a ton of referrals from their book and they have all these good relationships in the community, but you might need some gap fillers here and there, right? So you may give me 10, 15, 20 hours a week, depending on your availability. So it works for all levels of agents. The other thing about the program that I love is you, the agent, you guys are the ones, at least initially, that choose your days of the week, the times of the day, and the county or counties that you want these meetings to come from. We highly recommend that you stay within a 30 to 45 minute one-way drive from your home base when you're looking at zip codes and counties, because we do have a high show rate. 90% is our show rate. And so, but what does that mean? That means 1 out of 10 on average is going to port you or no show you. And so, so it's a lot, that 1 out of 10, it's a lot easier pill to swallow if you're only driving 30 minutes one way, as opposed if you're driving an hour and a half, as some agents, still like to, get large territory. So we recommend that, but you, the agent, are the ones that choose that. We have the ability to not only look at county specific, data as far as how many, meetings opportunities are being produced in that county, but we also have the ability to drill down into the zip codes to identify the zip codes within that county that are pulling the best opportunities for agents. And so initially, you're going to want to be in contact with your account manager, which is Chris, and Chris could look into the different counties, to wherever you're marketing yourself and identify those zip codes for you. And it's probably good practice to keep in touch with him once a month or once every 6 weeks, just to make sure that those zip codes that you initially chose are still the ones that are the hottest in that market. And so that's why it's great that Chris is on the phone or on the call today with us as well, so you can get to hear him, and he's a big asset to agents as they move forward in our program. I'm going to pause here real quick to see if any questions that come up.
Nope, we don't have anything in there yet.
Okay,
so far, you're doing it.
Perfect.
That's right. You're covering it all.
All right. Well, I also want to get into some real data as far as closing percentages and things of that nature. Last AEP, our closing percentages across the country was 55%. During OEP, it was 50%. And right now, during the ROI or SEP, whatever you call it, we're hovering in that 45 to 46%. So we stay pretty consistent year round. As you all know, this was a challenging year for not only us, but for carriers and you as agents, because there was a lot of market disruption this year. And you know, as you know, we're not allowed to market to the partial duals as we did for years and years and years. The only duals that we're able to continue to market to are the Heidi's and Fidey's, the full duals, and which is only 20% of the dual market. So our marketing shifted heavily towards CSNP. Okay, and so it's imperative if you're going to get on our program, at least at this point, and start working yourself into AEP, you're going to want to make sure that the market that you're in has CSNP plans available that you can talk to these consumers about. If there's not CSNP plans in your area right now, I would tell you that we have a different vertical that we might want to talk about. If you're licensed in multiple states, we do have an instant meetings vertical that I'll get into in just a second. But if you do have CSNP and Heidi Fidey fully dual plans in your area, we should be able to support you and make sure that you get a few more sales. So I mentioned the instant meeting or warm transfers vertical that we have. We just relaunched that program about a month ago. We changed platforms. We went to an Amazon AWS platform. Our connectivity rate skyrocketed because of this. You know, soon we're going to have the ability to actually send these calls directly to your cell phones. But right now, you'll have to be in front of your computer to receive those calls. But that is another option if your current state or area that you're marketing in right now does not have Heidi Fidey's or CSNP. If you are licensed in multiple states and are comfortable selling over the phone, then we have that option for you. Our in-person meetings are $100 per, and then our live transfers or warm transfers, our instant meetings, those are $39. And obviously the closing percentages on telephonic sales are a lot lower, but we've been averaging in that 20 to 22, 23% closing rate. Some agents do a lot better. You know, so we have agents on the program that are closing 40%, but on average, you know, we're seeing, you know, that come in at mid-20, right under that mid-20 number. You know, the program, you know, is a proven program. We have, you know, we do an extremely good job of getting you the agent in the home. Okay, and you know, when just based on our closing percentages, you might say, well, geez, you know, 55% is a great closing percentage, but you know, still, you know, there's 4 or 5 that you're not closing. Well, typically, when we see the dispositions, that in that case, the consumer typically is on the best plan for them at that time. And if that's the case, obviously you have somebody to talk to in October in upcoming AEP with a lot of changes that are coming. But while you're in the house, you know, ask questions. I'm sure most of you, if not all of you on the phone, sell other insurance products other than Medicare Advantage. Many of our agents that are on the program across the country sell different types of insurances once they realize it's not a Medicare opportunity. I had a gentleman in rural Georgia a little over a year ago. I like telling the story because, he went into the house. The guy was on a railroad retirement plan. He told the consumer, this is one of the best plans that you can be on. Do not move off this plan. But he knew that the gentleman was retiring. So he just asked a simple question. Hey, do you have a 401k? And the guy's like, yes, I do. And he just asked a simple question. Do you have anybody that can help guide you with that? No, I don't. And you would be surprised. And again, I'm talking to insurance agents, so you're probably not surprised, but there are a ton of people, especially that, those folks that have been working in like a UPS or like, that blue collar worker that's worked for the same company for 20, 30, 35 years, and they retire. And most of them, they dump their money into a 401k. And at the end of it, it's surprising they don't have a financial advisor or somebody to help guide them with what to do with their 401k. And so my point in saying this is, again, you all know, if you can get any kind of policy, or multiple policies with consumers, the stickiness, as far as they, sticking with you as your agent, increases significantly. So even if it's a dental or vision or final expense, hospital indemnity, there's a lot of opportunities for other sales. And so, so with that, I'll pause again to see if you have any questions that I can answer for you. If not, I'm gonna turn some things over here to Chris, and then again, we'll open it up for Q&A at the end.
Okay, I don't see anything, so we're going to go ahead and pass it over to Chris. There you go. Sorry about that. I was a little slow on the button.
No worries. Perfect. All right, so this is going to be the dashboard that all agents have access to when they first sign up. This is going to be where an agent does their training, their onboarding. As you see on the bottom here, this is the training progress. I'm showing you my account. This way I don't show any confidential information from live agents or live consumers. Here, you'll be able to see your territories as Gary mentioned. Now for my account, I only have Alaska selected. This way I don't accidentally get any in-home appointments I need to go to. So, but an agent's territory can be viewed at any time down here. Now the way an agent would change their territory, let's say after they get onboarded with us, is they would send us a simple email. This way we have a paper trail and a record of their request. From this home screen, you'll also be able to see what verticals you are active in. If you look at the top of my screen, you'll see a Med Express IP and a Med Express IM. IP stands for in-person. That will be the in-home appointments, while the IM is the instant meetings. And those are going to be the warm transfers. Then down here, breaks up from instant meetings, needs dispo, search and filter. This is how you would search the consumer cards. The consumer cards are really important. From here, we gather whether or not it was sold, not sold. Also in the consumer card, you'll be able to see their quiz results. These are all the questions that we ask the consumer on our line, the qualifying questions that the rep asks. Also, you'll be able to download the scope. Depending on which consumer path they choose and go down, there'll either be a text scope or an audio scope in which you could upload to whatever software you're using to complete the application. There's also a section for notes where the agent puts in, hey, gonna follow up, let's say, waiting for Medicaid approval or paperwork to be clear. All right, any questions so far with that?
Nope, I don't see anything.
Okay, yeah, so it's to be expected. We try as much as possible to streamline it and make it as intuitive as possible. Let's see, a couple other things. Calendar. So this is going to be the calendar that a agent connects to our platform with. The two calendars we asked for, as Gary mentioned, is a Google Calendar or an Apple Calendar. The calendars that may be, let's say, connected with an agency, a lot of times they use Microsoft 365. For whatever reason, they don't seem to integrate as seamlessly as Google and Apple. So if you have a Google based calendar, that will integrate the best. Then from here, you'll be able to show schedule. As you see on mine, for the most part, it is open, and agent will also be able to see this. Now, one question we get a lot is, are we able to see what's on an agent's calendar? No, we're not able to see the particulars. So if you have let's say a Medicare event at Walmart, or you have a seminar, or you have little Cindy's birthday, we're not going to see the particulars. We just see that you're unavailable during that time.
How is that information then communicated if your calendar does not coordinate? If you're on a calendar, you are on a 360 calendar.
How would it coordinate if you were? We ask that an agent, if they need to make a secondary calendar in order for them to connect to our system. But the good thing with that is if you look down here under my Medicare Express, you'll see Christopher@MedicareExpress.com. Whatever email they have on file with us, they will still get updates to that email. So whenever a meeting is booked, there's 3 notifications that goes out. There's the calendar invitation. There is the text message. That is a 3-way text message with the consumer. And then finally, you'll get an email confirmation to whatever email is on file.
Right. Is there a lead time to that, to get that email?
It's almost instantaneous as soon as the meeting's booked.
Got it. Okay.
Yeah, great question. Let's see. Not trying to get too granular with it. Settings. I'll just go over this one. 2 more pieces is when it comes to our in-person meetings, there is a duration drop down. From here, they can change it from anywhere from 60 minutes to 150 minutes, so 2 hours and 2.5 hours. We do not book geographically based, or we do not book meetings respected to the last meeting booked geographically. So whenever agent is putting their territory or their zip codes in, just keep that in mind. This way, we're not booking you one appointment at the end of town and then another appointment at the far end of the other side of town. But if that is the case, as you know, agents don't mind, especially if there's opportunity and they're willing to put in that drive time, just increase their meeting duration a little bit, and that'll compensate for that drive time. And then last thing is, depending on how an agent is funded, we recognize there's a lot of different funding options. Let's say they're rewarded based on their sales. I'm not too sure how you guys do it over there, or there's co-op money, or if the agent wants to pay for the leads themselves. At any time, they can click on agent funds and they'll see how much funding they have remaining. And it'll be itemized for them, such as self-funded, marketing co-op, and they'll always have a bird's eye view of that.
All right. Thank you, Chris. Appreciate it. One of the things too that I talk about a little bit is just some best practices. For those of you that are interested in the program and do want to join the meetings program, there's a couple things, and I talk to agents, and so does Chris, all day long, every day across the country. And I try to steal some best practices for them and share it with the rest of the agents that I talk to, especially new agents that are coming on our program. One of the things that Chris mentioned, there's 3 different types of notification that you get telling you that we've booked a meeting for you. When you get that notification, what I recommend that you do is you take a picture of your business card and you text it to the consumer. And say something like, hi, Chris, this is Gary Gore. I look forward to seeing you Thursday at 1 o'clock. Can you do me a big favor? Can you please lock my number into your phone? I'm going to call you on Wednesday to introduce myself. We highly encourage you to engage with the consumer prior to going out to the appointment. Especially if you are an agent that wants to expand your territory beyond the 35, 45-minute recommendation that I mentioned earlier. If you are that agent, I would highly recommend that you try to engage with that consumer, especially if you're driving over an hour one way. Not every person is going to respond back, but if you get 3 or 4 out of 10 that do, it's pretty much a lay down when you get to the house. Some people you'll get a you'll get a call back saying, or a text saying, I didn't want this meeting, or blah, I don't know what, I'm busy, when you can either reschedule or mention to them to call us and cancel the meeting, because a canceled meeting prior to going out to the consumer is a non-billable meeting. And so I think that's it's a very good practice to get in the habit of doing, by getting that business card to that person, because 2 things happen when you do that. One is you legitimize yourself as an agent, right? Most of you have your, or not, a lot of you have your picture on their business card now, and also your license numbers on the card. And so when a consumer sees that, if they had any inclination whatsoever that they didn't want the meeting, like they rushed us off the phone, or they just don't want the meeting, then they're going to call and cancel us. And so that's a big deal, and I highly recommend that you do that. Secondly, as far as the calendar management is also very important on our program. As we mentioned, we can't see where you're at. And so let's, for instance, if your normal appointment time is an hour and a half with somebody, like 15, 20 minutes to the house, 40, 45 minutes presentation, and another 15, 20 minutes back to your office or back to your home base. If that's typical for you, and you live in a rural area where there's a lot of drive time or windshield time, or even in a highly congested metropolitan area, I would probably recommend that you put in, and you could do it 2 ways. You could go to, Chris mentioned, you can increase your meeting time to a 2-hour meeting, or what I recommend is you just build in a little drive time buffer. So that way we don't book an appointment right at 10:30, because again, we can't see where you're at. And so you might be on the south side of town at somebody's appointment, and if you don't have a buffer in there after 10:30, maybe to 11, we possibly could book a meeting at 10:30, and then now you're 20, 30 minutes late, chasing that tail to catch up all day long. And so I highly recommend that you put in some drive time buffers, depending on your area and the traffic that you have to deal with. The other thing about the calendar that I always tell agents is, not only do we need to see your business appointments, but personal appointments as well. Again, we can't see where you're at or what the appointment is, but if you have a doctor's appointment, if if you have to pick up your kids from school every day from 2 to 3, if you got to bring the dog to the vet, these are appointments that you can't get out of typically, right? And so consumer experience is a big deal for us. I'm sure it is for you as well. And they book these times for reasons. And so we try to do the best we can to keep everybody on schedule. So just keep that in mind if you join the program. Drive time buffers are really helpful, and it'll make the program much more smoother for you.
So that just leads into the question of flexibility. If, say, I'm an agent who then gets called off, I have to take care of my child or something, how do I go about moving a preset appointment that you have set up for me?
Yeah, it's a great question, because it does, it does come up, right? Unfortunately, car accidents or flat tires, or things happen, kids get sick. Yeah, what you need to do there is try to attempt to call the consumer yourself, text, call. If you can't get a hold of that consumer to reschedule that, immediately send that to support@MedicareExpress.com. And by the way, this is all in that training, those four modules down there, all that's in the training. And
Yep.
By the way, just to let you know, the training is only about 45 minutes. It's a bunch of videos, and do yourselves a favor, don't treat it as a carrier research and click to the little test at the end, because this is a new program for you, and there's some little nuggets in there of information that'll really help you out. But again, it's only 45 minutes. It's not a time-consuming training thing, and once you get through it, you'll see a lot of the same things Chris and I are mentioning to you today.
Perfect. Good.
Yeah, it also in the training, I talked about in the training, you'll see some things in there like support@MedicareExpress.com. That is the email to our QA department. If you ever go to a meeting and you have and you get to this meeting and you're like, why was this meeting ever scheduled? I mean, something's really off, right? Or say maybe the person is not cognizant enough to even have a meeting, and it just so happened that day that we were talking to my agent, the person was. And so I had situations where young ladies, female agents had went to certain parts of towns and certain rural areas and weren't comfortable walking into the home because of one thing or another. And so whenever that happens, right? And here's another example. We do not book appointments. One of the disqualifying questions we ask is, do you have a current local agent that you're working with at this point? And if they say yes, we are not booking that appointment. We do not want to step on toes of agents that are keeping in touch with their clients and doing the things that keep them on your books. And so if that ever happens, because now and then one of our agents in the call center will do that, and you'll show up to a house and they'll say, well, I don't know why you're here. I told the person on the phone they already have a local agent. Matter of fact, they're going to be here in about an hour. And if that ever happens, I apologize up front. It doesn't happen very often. It shouldn't happen at all, but every now and then it does. But if it does, send that name to support@MedicareExpress.com. We pull the call. If the consumer says she had a local agent, then we credit that back, no questions asked. So we work with you. We want to be good partners with you. We want to hear some feedback from you as well from time to time. Some things that you might be seeing. And then there's also some things that we do for agencies and agents in certain areas that, maybe the UHC dual complete plan is the best dual plan in that market, and no other plan comes close to it. And so there's some times that we can actually filter out a specific plan if it's dominating in that area. And so so you don't get an appointment with a UHC person knowing that you can't flip that person to another plan. So there's a lot of things that we can do as we get going and as we partner together moving down the road.
Great, thank you. I still don't see any questions, guys. So now's your time. If you have anything, plop them into the either questions or the chat, whatever works for you.
Yeah, while they're thinking of questions, there's one other thing that's come to mind. I mentioned in the very beginning that we have a 90% show rate. What do you do when you get a no-show, right? Well, what we recommend that you do is notify us, as soon as you can. I just went to Gary Gore's house and he wasn't there. I left my business card in the front door. Can you help me reschedule that? If you send that to support@MedicareExpress.com, for the next 72 hours, our team, with the same team that booked the appointment, will actually reach out to that consumer to try to reschedule that appointment, as well as we expect you to try to help reschedule it. Whoever reschedules it first, we let each other know, and then we move on. If we're not able to get a hold of that person, if we're not able to reschedule, and we went through the Q&A and we scheduled that appointment properly, then it's still a billable meeting. But just keep in mind, you have a scope that's good for 12 months. You can mail to that consumer. You can knock on the door the next time you're in that neighborhood because you have a scope. And you say, hey, I'm sorry I missed you last Thursday. Do you have time to see me today? Again, you can call, text. So there is still opportunities, and many of the agents I talk to that do those things that I just mentioned, they're able to see the consumer, because you know how seniors are. A lot of times they forget. That's why I recommend that call prior to the meeting, so they remember you're coming the next day.
Sure, that makes sense. Okay, I still don't have anything to come in. So what I'm going to do is I'm going to take back the screens and just do.
I was going to ask one question, Lisa.
Sure, go ahead. Go ahead.
To the group, has anybody on the phone, have they heard about Medicare Express, or have they used Medicare Express in the past?
Let's see if we get any kind of response. I don't see anybody jumping in.
Okay.
I'll certainly keep an eye on that and gather it for you. Yep, yeah. This was some really good information. As I've taken back the screen, I'm going to flip just to our next page so that you can, as we do our quick housekeeping, second line down there is our $500 monthly lead program. As most of you probably on the call know, that we'll reimburse you $500 a month for your leads for your Medicare leads, Medicare only, and this would certainly qualify. So you could actually give this a good shot and have nothing out of your pocket. It's a good way to get started. Still nothing coming in as far as questions or hands raised. So unfortunately, everybody's being shy and doesn't want to answer your question.
Well, I thought it was going to be because Chris and I did such a good job of explaining our program that, nobody has
you absolutely did. I mean, I've heard of Medicare Express, and I've been, reading and watching, and this was a really good presentation. You guys, I still took another whole page full of notes, so that is a really good job.
Thank you.
Just our final quick housekeeping. Remember that if you reach out to us, we can offer you the $50 AHIP discount. We still offer our T65 seminars. We will help reimburse, again, 50% of the cost of that service. And we have our exclusive Boss for Agent portal available to any agents that are contracted with us. Most of you, I know, have already heard that information. So given I don't see any questions or comments rolling in, I'm going to flip to the next page. Remind you that my name is Lisa Osborne. I am the broker manager here at Crowe & Associates. On the screen, you'll also see contact information for Stephanie Taylor. She's our sales director. Please feel free to reach out to us at any time with any questions, any concerns, anything we can help you guys with. Unless you guys have anything else, we're all set for the day.
Thank you so much again, Lisa. Thank you for the agents for taking some time out of your day to listen to our program, and look forward to helping you make more sales, whether it's now or in the near future. Thank you again.
Us too. Thank you. Thank you, Chris. Thank you, Gary. Everyone have a great day.
You too. Thank you.